So Europe is large. We're large countries. And I always say that Norway, if you look at Norway, if we turn Norway around, we'll end up, somewhere around Rome. Yeah, that's what we say in Norway. So we're a small country with 5.5 million, but it's far away. So we've been working together. I came along in spring last year, and I met some super nice people that are just so interested in the same things as I am. And I thought that's been great. Because when I was diagnosed in 2019, I couldn't find anything in Norwegian. And I started talking to the doctors. And when I came in, they said, oh, well, it's 2 millimeters. We'll just take that out. And my question was, 2 millimeters, can we just wait? I think people are over, diagnosed, and we'll just wait. And they said, looked at me and they laughed. And they said, no, well, then in 2 years more, it will grow. But we'll just take an MRI. Okay. And then they called me and said, it's 5.5 centimeters, 1 centimeter, and in 1.5. So we recommend to take the whole breast away. And I thought, what happened here? I just couldn't understand it. I wanted the pathology report. So I came into the hospital and they said, no, we don't give that to the patients. And I really wanted to have it. So I just said, could we print it, please? And they came out on a piece of paper with labels, because they used it to print out, blood tests. So they didn't want to give it to me, but I got it. And then I understood it's lobular breast cancer, and I never heard about it, and I never knew that it couldn't form a lump. And so when the brochure came along, I was so happy, because now finally there is something we can share that we can understand. And what I discovered was that when we shared it with the other researchers, some researchers in Bergen, where you were, they were so impressed and they wanted to. Who made this? The design is so good. It's so easy to understand. We want to use it for more things. So I thought that was really, really nice. And I shared it with researchers in many places in Norway and patients. But it's hard because most patients in Norway are not told what kind of breast cancer they have. They just know breast cancer. Yeah. And so, see, Norway is large, and I tried to pinpoint the places where I have connected with breast cancer groups that I'm now talking to and giving them information about lobular breast cancer. But the one interesting thing is that up north, where you can see there's 2 arrows, one of the groups is also connecting to, because I don't know how much you know about Norway, but there's Sami people up north. So it's indigenous people, and they also collaborate with people in Sweden, Finland, and in Russia, because there are Sami people there. And it seems like some of them are really late in their diagnosis, and they don't get much information. So I think that's interesting. I've also connected to the Norwegian Breast Cancer Society, but when I called the president and told them that I've been asked to join this ELBCC, the president said, lobular breast cancer? I've never heard of it before. No, I've never heard about it before. I've heard about breast cancer in men. And I called Siobhán, and I was shocked, and we were both shocked. I had to have a glass of wine that night. And then I was called for my work. They were giving an interview, because I have a job that's many people know what I'm doing. And so they were asking me to give an interview. And the thing come up on the paper was, when I noticed that the cancer that I had was really rare, I started reading research papers.
Could you just put it into English, the heading there?
When I realized that the cancer I had was rare, I started reading research papers. And that's how I found you guys. That's how I found LBCA. That's how I found Christine, Steffi, Otto. And when I called the hospital and I started questioning my diagnosis and what they did, I sent them a huge amount of papers, research papers, because I wasn't really happy what they told me. So they changed what I did. And then also, I attended the what do we call it? AGM, the annual general meeting for the Norwegian Breast Cancer Society. And I didn't, they gave an action plan for 2 years. And I wanted to include something in the action plan because I thought it was important, because I had gotten to know a lot of patients in Norway through posting things on the Facebook site. And I knew that breast density wasn't a thing we talked about. So I asked to put in that every patient should be informed of what kind of breast cancer they have and their breast density. And if their breast density was factor, then they should be offered MRI and ultrasound. And that was added to the action plan this spring, actually. So I'm really happy about that. And now I am together with 10 other patients in Norway, breast cancer patients, different types. We are forming a group that are collaborating with researchers. So it's kind of apart from the Breast Cancer Society that are interested in research. So I hope that will help us. Yeah. Yeah. And then, maybe you want to say it.
Yeah. Okay. So we just wanted to include Rianne Tavir, who has worked extensively. Rianne joined ELBCC. She was the first one of the advocates to join. Thijs, I know you've worked with Rianne and you've done some webinars on Facebook. I could not understand any of it, unfortunately, but it's important, I think, that this kind of thing happens, and it's a really good collaborative tool to have for women to be able to speak to you, in their own language, so that nothing gets lost in translation, because we know that happens. So Rianne, unfortunately, isn't with us, but I have spoken to her and she wishes all of you a really good ILC symposium, and we've been posting information to her. We also have sent some flowers to her. We wanted to really make her feel that we miss her, and we do miss her. So these are just a number of things that Rianne is involved in. She's worked with Patrick, I know. A lot of you here will know her, so we'll do the next slide, I think.
She's also doing a lot of fundraising.
Yes, indeed, and with the Breast Cancer Association in the Netherlands. So some of the patient advocates here will know Rianne very, very well. And we can just move on again. So the Dutch Lobular Facebook group, which started in 2018, ELBCC involvement, Dutch Oncology Days in various hospitals, and that's where Rianne is very effective on an outreach basis, both with patients and clinicians. And I think we will just keep this moving because we've quite a number of slides. So, okay, so it's kind of over to Lobular Ireland at this stage, and that's me. So I came into this when I contacted Patrick. I was looking up information about the RATHER program that had begun, and I found some interesting information there. I found Patrick's name. I thought, okay, let's see what's happening in Europe. Discovered ELBCC, came to the Leuven meeting, where I met quite a number of you here, and we're all there on the screen. So the next one there would be, okay, so this is something I'm really, really, really happy to tell the audience. It was a surprise to me. I made an application some time ago to the Irish Cancer Society when they advertised that they had a Patient Advocacy Champion Award. So the award is for somebody who wants to either go to a conference or get involved in research. It has to be a very specific event. But then if you're chosen, they will cover your costs and your attendance at the event to quite a substantial amount. It's a one-off, but I was chosen this year, and I got the letter of intent only just a few days ago. So I'm really, really happy to say that the Irish Cancer Society have recognised Lobular Ireland as an entity, and that they felt that it was important to sponsor me to come here to Utrecht. So huge thanks to them. Thank you. This is just something that we did for October Breast Cancer Awareness a few years ago now, pre-COVID. We planned to meet, we planned to do a lot of things, but COVID got in the way. But we will continue this. So we started off with I Am Lobular, and I suppose I am Lobular Ireland anyway. And I've spoken at conferences with Precision Oncology Ireland and the Breast Predict programme, which ran for 5 years under sponsorship from the Irish Cancer Society as well. We encouraged women to put their faces up on social media and just get the message out there that lobular cancer is exactly what it is, and that you know, we're a small number, but we collectively make a huge number across Europe, and we had a huge response to it. As you can see, they're just very small number, but we had thousands of women identifying with lobular from right across Europe, and it was a really lovely thing to do. So we hope to expand on that. Oh yeah, okay, so ways in which we can, you know, communicate. So Dr. Steffi there was very, very kind and agreed and gave some time to Lobular Ireland, and we had a really lovely webinar, and we've run another one since where we had Karen and Elspeth and a few other people involved in that. That at the top there, Breast Cancer Isn't Just Pink, was from the Marie Keating Foundation, who are very, they run a lot of events and information in Ireland. And so we did that 2 years ago for breast cancer awareness. The other thing that I'm extremely passionate about, and I think you all know, I run the Irish and European education and awareness for breast density. So that's something that we hear more and more and more from women with lobular, that they have dense breasts or that they didn't know that they had dense breasts. I'm not going to talk about it, this isn't the platform, but I do want you to be aware of it, and I know that patient advocates in the audience can identify with it, so it's something that, you know, we may see more of. Ways in which we have public and patient involvement, PPI, in Ireland. We ran the first mammographic breast density, What Women Need to Know, and it was co-hosted with Professor Liam Gallagher from UCD, and the Breast Predict programme, again sponsored by the Irish Cancer Society. That was in 2019. Lobular Ireland, we began just in parallel with that. You can see Darren O'Connor there and two other researchers from the RCSI, Trina Nakungala, and we have Elspeth Ward with us. I'm not sure if Elspeth is here, but she certainly will be. I know she's talking later on. The ILC patient advocacy organisations, we have an international collaborative meeting every, I don't know, how often do we do it, Laurie? Every 2 months? Yeah. So we all meet and get together and talk. And I'm really happy to see that Cancer Prev logo there in the corner. I don't know if Catherine is, yeah, Catherine Briskin with us. So the next slide will explain why I have the privilege of including that. Not the next one. Okay, I'm not going to dwell on this, but there's a whole host of areas there that you can get involved as a patient advocate on steering groups, you know, talk to the various different agencies. You do not need to belong to a huge organization. There are lots and lots of ways that you can become involved in lobular patient advocacy, and there's room, and more and more we see advertising for opportunities. So these are some of the ones. The Royal College of Surgeons, there's an Emerge Breast Cancer Research Advisory Panel who are linking in with the breast screening. IPOSI Patient Advocacy Engagement, they run courses in with UPATI. So that's another European entity. Royal College of Surgeons, Royal College of Physicians there as well. So, you know, I suppose it's interesting as a non-academic to know that your opinions are needed, I suppose, to fulfill a lot of the criteria. So I think the last slide. Okay, so this explains why we have Cancer Prev up there. I was very privileged last week when I was invited to attend the International Cancer Prevention workshop. Have I got that right? Okay, so, and that came from Catherine Briskin and George, who's sitting up here. We were in a beautiful place in Bologna, in Italy, and this happened on the last day. So I have the privilege of having been awarded the ICPI Lifetime Achievement Award in Cancer Prevention. I didn't ever think I would be awarded anything for efforts in cancer prevention, but I'm really, really, really proud of this. It was a wonderful way to come into this event. So 2 good news stories. It's taken 6 years, but hey, look, it's there. And I got the cheese. Yes, but I got the cheese. So thank you, Catherine. It was a wonderful event. I'll treasure this. It means a lot. I believe the first one went to Professor Tony Howell. Am I right? The first of these awards. So I'm second, and I'm very, very, very proud. Thank you so much. So I think if we can just go back to any questions from the previous group, I think would be important. So we have 2 microphones in the audience if anybody has a question that they would like to ask Laurie or Claire or David, Karen, anybody there at all. Or indeed, if anybody would like to ask Toon or I a question.
Yeah, anything about the whole morning session, I would say, as we're wrapping up this session.
Yeah. And the other thing I would just like to say, sorry, can all the patient advocates make their way up onto the stage at the end of this so that we can have a photograph of all of the advocates who attended? That would be really important, if you don't mind, just at the very end.